The honourable member for Vancouver Centre.
Mr. Speaker, the international scientific community today slammed this Conservative government for a serious breach of international scientific standards and political interference in Vancouver safe injection sites research, calling it a political horror story. Australia's Dr. Wodak says they ignored science, due process and public opinion, risking harm to the country's international standing. Ideology over evidence harms people, and this government doesn't care. How can the Minister of Health defend his irresponsible actions?
The Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Mr. Speaker. The allegation is obviously false. I'd like to draw to the member's attention a statement made by the chair of the Independent Expert Advisory Panel. It says that the version of the report concerning the estimated number of HIV cases that may have been prevented was in error from the earlier draft and was deleted and amended at the request of the chair of the AEC after consultation with the other committee members. I wish the member would get their facts straight.
Honourable member for Vancouver Centre.
Mr. Speaker, this minister ignored 22 reports proving the effectiveness of Insite. He refused to commit support. He's running out of excuses for leaving Canada's harm reduction programs in the lurch. This is a severe indictment on Canada's international reputation and blatant disregard for the health and safety of its citizens. When will the minister finally acknowledge the scientific evidence on Insite, remove his research moratorium so other communities can benefit from the proven strategy?
The Honourable Parliamentary Secretary to the Minister of Health.
Mr. Speaker, in fact, the minister did extend the exemption for the Insite program until June 30th to gather more scientific information. What would be really helpful, Mr. Speaker, is if the opposition party would support our programs on helping victims and also putting the drug pushers and other people who prey on the most vulnerable, help support the government policies and rather than just fearmonger and do nothing.
The honourable member for St. Paul's.
Mr. Speaker, there's no scientific evidence to support the minister's opposition to the Insite program. In fact, the government offered money for additional research, but only if the investigators would not release the evidence until after the exemption for the Insite program expired. Dr. Evan Wood for the BC Centre of Excellence for HIV/AIDS has called this muzzling researchers. The University of British Columbia has called the minister's conditions ethically unacceptable. When will this minister stop embarrassing Canada by choosing evidence over his ideology?
The Honourable Parliamentary Secretary to the Minister of Health.
Well, Mr. Speaker, again, the member is ill-informed. This minister has extended the exemption in order to, on 2 occasions, in order to gather more information, and no decision has been made on what the government intends to do because we're taking a close look at the research. Will the member please support the government and do what's best for Canadians? Stand up for Canadians rather than sitting down all the time.
Honourable member for St. Paul's.
The Minister of Health is now a harm reduction denier. He doesn't care what the experts say. The Medical Officer of Health for British Columbia knows that the Insite program works. Health Canada in 2006 decided that the program was working and recommended the program be extended. When will the minister take off his ideological blinders, face the facts that harm reduction works, and extend the Insite program, or would he prefer to just stick to his present program of harm maximization?
Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Mr. Speaker. And again, the minister is doing what is best for Canadians. He's looking at the research. We've extended the exemption in order to do this. What is causing harm are liberal policies, liberal inaction, lack of liberal leadership, lack of liberal vision. I think Canadians have decided the best thing for harm reduction is to stop voting for the Liberal Party.